like to introduce my project entitled Adult Awareness of the Effect the Oral Cavity Has on Systemic Health. My name is Dr. Charmaine Chappell. I'm a recent graduate of the Industrial Organizational Psychology degree. My goal is to improve community awareness of the effect the oral cavity has on overall health and wellness. I've been in the dental field for over 20 years, and this project is near and dear to my heart because the dental profession is the only profession where a person's life can be changed in 20 minutes or less by changing their smile. I am a retired veteran of the U.S. Navy. The topics that will be covered in this PowerPoint presentation will be an introduction, general information, specific information, the importance of the project approach and questions, results, and conclusions. Whereas published research states that adults between the age of 18 and 64 lack the desire to make a behavior change, even with awareness of the effect the oral body has on systemic health. This project is looking to fill the research gap of finding when and where dental patients are made aware of the oral body link in a hope in lessening the adverse consequences of chronic diseases linked with oral disease. The importance of this project is because lives can be saved if the awareness of the oral body link is disseminated in all populations. The contributing awareness of the link of oral health on overall systemic health is the importance of this project. Government officials, researchers, medical doctors, and dental professionals alike are aware of the oral body link. So why has the link between oral health and systemic health not been widely broadcasted to the general public to decrease health care costs and the treatment of systemic health problems? The fact is that oral disease increases in adult populations aged 30 and older, affecting about 64.7 million adults. In 2016, $124 billion were spent on dental expenses. And since 2015, there's been an increase of 3.3%. The Affordable Health Care Act gave millions of American adults access to medical care, with an additional cost option for dental care. Many adults did not choose to opt for this dental care. Instead, they seek out the medical emergency rooms for immediate, non-traumatic dental care. However, all children with parents or adults, guardians, subscribing to the ACA received dental insurance coverage. But adults aged 18 to 64 are the most affected by dental decay. The project approach attempts to explore awareness of adults aged 18 to 64 on the effect the oral cavity has on systemic health and wellness, determined by expert opinions and increasing compliance with good oral hygiene to prevent associated systemic disease. This project approach was completed by analyzing surveys completed by medical and dental professionals, the general public, and comparing that information to previously published research about awareness. It has been proven that adults have significant gaps in their grasp of information routinely provided by healthcare facilities, pharmacies, the media, and other sources in the community. There is a low awareness of the links of oral health and systemic disease. And this is linked to poor health outcomes such as higher rates of hospitalization and less frequent use of preventative services. The cognitive framework by Albert Bandura was used to actually explain the social learning theory. Adults have to have attention, retention, reproduction, motivation in order to make a behavior change. The attention is the behavior must grab the attention of the adult. The retention is the observer must remember the observed behavior. Reproduction is the observer, which is the adult, must possess the ability to make and easily imitate the behavior, noting their physical, cognitive, and limitations. Motivation is the observer, which is the adult again. Behavior must incite the will over the observer. Now, the results were derived from a survey from the healthcare professionals, a survey completed by the general public, and these results were triangulated against pre-published research. So questions were asked about awareness and dissemination. As one interviewed dental professional stated, the oral cavity is the gateway to our body. So what we directly put in our mouths and the amount of care we give to our hygiene results in the observed condition. Healthcare cost of treating chronic disease is $3.7 trillion, approximately 19.6% of the U.S. gross domestic product. Haynes and Gillian, 2020. The results actually came from looking at 6 categories of survey questions. These categories included awareness, behavior change, diseases in the population, expertise of the medical and dental professionals, if the general public or medical or dental professionals would seek further information, and then population information, including gender, medical and or possession of dental insurance, and when was the person's last cleaning. All these categories together give us a view of awareness. Research question 1 looked at published awareness and the research results. So the published awareness was that 93% of healthcare professionals agreed that there is an associated link. 85.6% of the dentists believe oral disease has a negative impact on patients' quality of life. Nazir, ETAL, 2019. The general public, on the other hand, 60.4% of the polled patients felt oral hygiene is mandatory for overall health of the body, whereas 41.2% of the polled patients felt there was no need for dental examinations. Then you have the research results. 100% of healthcare professionals say that they know about a link. They're completely aware and share this information with their patients. 60% offer patients information about the oral body link. 80% of the polled healthcare providers see patients with heart disease, diabetes, cancer, osteoporosis, and respiratory disease. Many of the diseases that have been linked to periodontal disease. Now, comparatively, the general public says 79.5% were aware of the oral body link. 35.9% were informed by their medical or dental professional. 56.4% received literature about the oral body link, and 48.7% decided to make changes in their overall oral care because of their awareness. 84.6% agreed that they would seek out more information about the oral body link. Now, research question 2 looked at the dissemination of information. So, most providers gave out information in writing to their patients, and they disseminated this information after the dental or medical visit. The reason being is because a lot of information was already passed during the visit, and now this information that they're given to take home only concretes all of the information passed during the visit so that they can go and look it up further to get more information. Research question 3 actually looks at the literature results about if the general public received literature, was aware of the links, if they were informed of the link by a healthcare professional, and if they would seek out more information. And you can tell that most of the general public did receive information in one form or the other. But in contrast, only 49% of the general public said that they would make a behavior change, even with awareness. Whereas 51% said, I'm not going to make a behavior change, even though I'm aware. So in conclusion, we know that awareness of the oral body link has been tied to heart disease, diabetes, respiratory disease, osteoporosis, cancer, and much more research is being done. We have the Affordable Health Care Act, which is trying to make it possible that all children get dental care. But the greatest population that's affected is 18 to 64. So there needs to be a change made where this age group can get dental coverage. And this will save approximately $64 billion in healthcare costs, as well as save emergency rooms that should be directed for medical care from treating patients with non-traumatic dental disease. Thank you for this opportunity to discuss my research. My contact information is listed below, my cell phone number and email. Thank you again. Have a great day.